Thank you, Michelle. Good afternoon, everyone. We'll call the afternoon meeting of the Public Safety Subcommittee to order on October 13th, 2020, and it is 2:02 or 14:02, as the police would say. And Madam Clerk, if we can have the roll call and posting of the agenda, please.
Member Lopez?
Here.
Member Ramirez?
Here.
Chair McDonald?
Here. And Mayor Pro, I'm sorry, go ahead. My apologies.
No worries. We have a quorum. The agenda for this meeting was posted in the City Hall kiosk on Wednesday, October 7th.
Thank you so much. Mayor Pro Tem, if you'd be so kind to lead us in the pledge, please.
Please rise, everyone. Place your hand over your heart. Ready to begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Thank you, Mayor Pro Tem. I'm told by the clerk that we have no public comments on items not on the agenda, so we will move into the consent agenda. And have you both had an opportunity to look at the minutes from the last meeting?
Yes. Move to approve.
Second.
Okay, Madam Clerk, if we can have a roll call, please.
Member Lopez?
Yes.
Member Ramirez?
Yes, I'm approving, even though I understand that I wasn't there, but I understand you still might need me to approve it. And I see nothing trouble there. Thank you.
No, it would still be appropriate for you to make the motion even if you weren't in attendance. So that's good.
Thank you.
Okay. And Chair McDonald?
Yes.
Okay. The motion carries 3-0.
Thank you. We'll move to section D, report D1, ambulance consulting agreement. And is the fire chief here today, or are we getting a sub?
You're getting the real deal.
Good afternoon, everybody. Chair McDonald, Public Safety Committee members, I want to thank you for your time today. For this subject, there is a lot of information that we can cover, but I'm going to do my very best to try and keep this presentation at a fairly high level. And so, first thing I wanted to go over is this is actually we provided a presentation to this group in September of 2019 regarding the EMS agency, also known as the LEMSA. They provided a consultant report, and so this is a follow-up from that presentation. We are going to discuss some of the enhanced service potential for our ambulance system, some of the issues that surround local control, and then finally we want to talk about the economic viability of the ambulance system. And please feel free to stop me at any point. It might be easier than waiting till the end for questions. So the first thing I wanted to go over is, as you may recall from the presentation that we made a year ago, the LEMSA hired a consulting firm, Page, Wolfberg and Worth, or PWW. That study was, the entire study really was biased. Certainly Oxnard, the City of Oxnard or Oxnard Fire Department was not given an opportunity to present or even be a part of the study design. Cherry-picked data was used to make it look like the status quo was the best and indeed the only option to be presented to the County Board of Supervisors. And so some of the issues that that came up from that study and some of the things that we talked about a year ago was that one of their recommendations was actually to increase ambulance times, or the way they phrase it was to relate ambulance response times to clinical outcomes. The weakness in their argument was that the recommendation was actually based on profit, not on clinical outcomes at all. Additionally, that consultant report didn't actually audit the financial data of the ambulance companies. And there is a good reason that ambulance companies are not owned by publicly traded companies. They use the term uncompensated care to essentially cry poor or create tax incentives for themselves. But these companies are not here for the public good. They're here to make money. They actually have, AMR actually has a clinical division that isn't actually there to improve outcomes of patients. It's to figure out how to maximize profits while minimizing harm. So additionally, the study itself didn't look at individual cities. It didn't look at changing, as you might recall from the last time we presented, there's lots of acronyms in the EMS world. And so one of those acronyms is exclusive operating area. And so the study didn't look at individual cities or look at changing any of the exclusive operating areas, or EOAs, as we call them. So one of the things that the report highlighted was there's no clinical basis for the 8-minute time standard they are currently held to. And that is actually true to a point. The problem is that they fail to address the fact that the reason the clinical benefits, there isn't a clinical benefit for the 8-minute response clock is because the benefits are really most pronounced when first responders can arrive on scene within 4 to 5 minutes. Once you get to 8 minutes, to a large extent, the patient outcomes start dropping quickly. So indeed, additional studies have shown that longer response times result in longer hospital stays. And so arriving on scene quickly provides not only system benefits, but also socioeconomic and healthcare benefits. To put this another way, our own LEMSA calculated that for every 1 minute of improvement in response time equals an 8% decrease in mortality rate. That study was never actually, it made it to peer review, but it was never actually distributed or released publicly. Another key point, the ambulance company's current contract fines them for $20 every $20 per minute they are late past their 8-minute response time. And so I guess now you have an idea of what 8% mortality is worth. It's about $20 according to the ambulance company. So not surprisingly, the study that the PWW generated, unsurprisingly, recommended that the LEMSA continue the grandfathered ambulance contracts. These are contracts that have never gone out to bid. And so I want you to stop and think about that for a second. When have you ever seen a local government or a county government contract be awarded without a bid, considering that this contract would be worth $400 million over 10 years? So, and if you look at the organizational chart of county government, the person in charge of making this recommendation to the County Board of Supervisors, who's the LEMSA administrator, is essentially the same level of authority as maybe a captain or a battalion chief. And so if nothing else, this idea of grandfathering is just not good governance. So the fire department and our residents currently rely on Gold Coast Ambulance for ALS services and transport. And keep in mind that the original system was designed to have 7 different exclusive operating areas, or EOAs, and they would be covered by 7 different companies. There are now only 2 companies, and one of them runs 6 out of the 7 EOAs, including Oxnard. Indeed, the original document, and you can see the cover of that original document on this slide from 1976, stated that we should have a minimum of 5 ambulances for a population of 200,000. Since AMR bought Gold Coast Ambulance in 2010, we've essentially lost 2.5 24-hour ambulances. And so we're now down to 4.5 ambulances here in the city. Recently, we had a 2-year-old drowning victim, and the response from the ambulance took 10 minutes. When we reached out to the LEMSA to find out what the outcome of their investigation into that incident, their defense of the response time was that their response time was challenged, and I quote, challenged due to construction and peak time of day traffic. More recently, we had a 1.5-year-old child that was having an allergic reaction. This was an allergic reaction so severe that the parents actually administered an EpiPen prior to our arrival. I'll tell you that that child is extremely lucky that we had a paramedic on the responding engine, or there was a very real potential for a negative outcome. That ambulance took 21 minutes to arrive on that call. When we reached out to the LEMSA to find the outcome of their investigation into that lapse in coverage, they didn't even give us a response. The last bullet point there that talks about the disproportionate impact for Oxnard, that's due in part to the fact that we have a relatively small number of paramedics in the Oxnard Fire Department relative to the jurisdictions that surround us. So we rely on Gold Coast Ambulance to provide that ALS service. Yet they are often moved into other jurisdictions to cover the 8-minute compliance clock for other EOAs other than Oxnard's. And so it's an important point that I wanted to make at this point. Chair McDonald, I know you've made mention in the past about the fact that we do not have a trauma designation for our local hospital here in Oxnard, which is a big issue. Us addressing the ambulance system here in town is something of a stopgap measure for us when it comes to getting to a trauma patient quickly and then getting them on the road towards a trauma surgeon quickly. And so this is something that we can do to improve the outcome for our trauma patients while we work on a longer term goal of getting a trauma designation for St. John's Regional Medical Centre. Moving on, so based on, really it was born out of the frustration that we were having with the service delivery from the ambulance company and the LEMS's inability to help improve service delivery to our residents. So that's where, with the support of City Council, we started our own Advanced Life Support, or ALS program. And in a short period of time, that program made a huge difference to the level of service, particularly for our South End residents. And the next two slides, I'll have to go back and forth a little bit just to give you a sense of what changed. But you can see here in this slide, those yellow bubbles, that was where the response times were longest for ambulances and outside the 8 minutes. And it's important to note that the highest areas of a lack of compliance also happen to occur in our poorest parts of the city. And so by us creating an ALS program that ran out of Fire Station 8, covered the South End, what that ended up doing is it's resolved the issue in the South End of town. What unfortunately occurred though is the ambulance company, with the LEMS's support, moved ambulance units out of the South End of the city. And so what ended up happening is they redeployed those units because we had an ALS resource in the South End of town. They actually moved those units further north to cover issues that we're having for coverage in Ventura and Camarillo. And so you can see, if I go back one slide, there's that yellow circle by St. John's Hospital. Part of the reason that went away after 1 year of the squad is because the two ambulances were moved out of the city to cover Ventura and Camarillo, and the freeway corridor back and forth. And you can see, because that original yellow bubble was close to the freeway, that's why that went away. And so essentially our issues in terms of ambulance compliance and that 8-minute clock essentially just moved to the center of the city, because our ALS program was covering the South End, and then the ambulance company moved those ambulances to the north, and you can see they were covering the north, creating the hole that we now have in the middle of the city. And so therein lies the issues that we have with the current ambulance contract and the LEMSA. So council supported the creation of an ALS program. That program improved response times and probably improved patient outcomes, but it was a little bit too early to measure. However, with the LEMSA's support, the ambulance company just moved resources out of the area. Worse than that, we had planned on the ambulance company providing financial support to our ALS program, as they would be given an extra 2 minutes to respond, because our ALS squad was already responding. This is the same arrangement that Ventura City and Ventura County Fire Departments enjoy. Ventura City receives $500,000 a year for their paramedics, and Ventura County receives $1.5 million a year for their paramedics, because it allows the ambulance company an extra 2 minutes to respond. Yet the LEMSA gave the ambulance company the extra 2 minutes before we had made a deal, and then refused to rescind that extra 2 minutes when we asked, because they said they were contractually obligated to give that to the ambulance company. And all of this was done for better coverage countywide. And that statement in that bullet point, that is why we are so driven to make changes. Because please keep in mind, the system was designed for 7 providers, broken into EOAs that were each supposed to be sustainable. Yet AMR now has 6 of those 7 EOAs and is trying to squeeze every penny out of those 6 EOAs to the detriment of Oxnard residents. We are always the first EOA to lose ambulance coverage as they move them into Camarillo and Ventura. The other thing too, that one thing that we've noticed, when Squad 68 was taken out of service in the last round of budget cuts, one of the things that we did notice was that it appeared that AMR and Gold Coast were really struggling with their contractual compliance here in Oxnard. And I can tell you that's the first time ever, as long as that we can go back in records, that they've ever struggled for their 90% compliance for that 8-minute standard. And so it goes to tell you a little bit of the story about how they moved resources into other areas of the county and changed the way they were providing coverage based on having just that one additional squad running out of Station 8. So when we talk about local control, what we're proposing to do is take back local control over our ambulance system. And then there is a wide variety of options available to do that. But what local control means is that we set the standard, and when the standard isn't met, we can hold people accountable to that standard. The goal would be to develop a system that meets the needs of our residents rather than the profits of an out-of-state company. And indeed, telemedicine is one example of an innovation that we made. We built a telemedicine program. So just to clarify very quickly, telemedicine is something that exists in just about every doctor's office and healthcare system anywhere, particularly in light of COVID. We built a telemedicine system for the point of dispatch, meaning that we could have firefighters respond to a lower acuity call, meaning they weren't a very sick patient, and we could actually facilitate a consultation between a doctor and the patient right there on scene, saving the need for that patient to be transported to the ER. The whole idea of building this concept was we built it at the beginning of the pandemic so that we had surge capacity and so that we could keep people out of the ERs if they had lower acuity issues. And so that way there was more beds for sicker patients. And so unfortunately this program hasn't been implemented yet, and that's in part due to delays from the county in trying to get that program stood up. Additionally, that telemedicine program would have an ability for cost recovery, while obviously providing a much higher level of service to our residents. So that's just one example of innovation that we can create and indeed are working on. But ultimately, the goal would be to have more EMS resources available to our residents. And so one of the things that you'll hear a lot from ambulance companies is that there's no money. They're a paper-thin margin. They're barely making a penny. And they do that in part through their creative financing. Indeed, AMR actually, in that PWW report that was produced, AMR actually said that they lost 3% in 2018, which just defies belief. They would have left if they'd lost that kind of money. Ambulance companies generally don't stay in a jurisdiction if they can't make at least 10% on their revenues. And when you talk about reinvestment in our local community, there is no longer any reinvestment here in Oxnard. Any reinvestment only happens at the county level. A couple of small examples is that when Gold Coast Ambulance, prior to 2010, when Gold Coast Ambulance was owned here locally, they used to provide an ambulance standby for the Powell Boxing Tournament. They used to provide an ambulance standby for the Strawberry Festival. Both of those events now have to pay if they'd like an ambulance to stand by. But again, this is a company that's all about maximizing profits, not serving the public good. So what we're looking at doing is we are working on a feasibility study that will provide options for Oxnard to assume control and provide for reinvestment. So the roadmap. What the fire department is proposing is to conduct a feasibility study to look at the ability to provide a high level of service to our residents in a sustainable way. We believe there is significant revenue in the city to provide additional resources. Our goal would be to provide a first responder ALS personnel on scene of 90% of calls within 4.5 minutes. This should be the standard that we strive for. But more importantly, we believe we can innovate EMS delivery, a service delivery. We believe we can establish this as an enterprise fund that would be self-sustaining and require no general fund support. This pandemic has illustrated once again that there are health inequities that exist in our society. We believe through targeted programs in our EMS delivery system that we can change the dynamic in health equity by reinvesting in our community. And so the fire department has actually already established a sole source contract with a consultant by the name of AP Trident to conduct the feasibility study. And I'll just give you a quick story, if I could. AP Trident recently did a similar work for Chula Vista, the city of Chula Vista and Chula Vista Fire Department. Prior to AP Trident's study, Chula Vista had 3 24-hour ambulances in their city, and they received about $900,000 in revenue from the ambulance company. The system that they're now implementing will involve having 5 24-hour ambulances and 2 12-hour ambulances, as well as an additional $3.9 million in revenue. The numbers are staggering, I'll tell you. So today what we're asking to do is to actually add 2 amendments to this existing AP Trident contract. And so the initial contract for $62,000 is the first 2 bullet points there, which is providing evaluation of the system and then some different system design options. If this feasibility study shows a fiscally responsible system to implement, we'll then look at implementing the other 2 amendments which are under consideration today. And so it is also worth noting, though, that the total cost of this contract is actually under the threshold for council action, but we thought this was an important topic of significant public interest. And it's also important to note that the 2 amendments will be written in such a way that the winning bidder for the RFP, for the ambulance RFP or the billing RFP, will actually pay for the cost of those amendments. And with that, I'm open to any questions.
Thank you, Chief. Committee members, do you have any comments or questions of the Chief?
I do.
Mayor Pro Tem?
Thank you. Well, thank you, Chief. I have to say, I'm just appalled at the report and what the consequences have been for our residents. Can you hear me okay? Yeah?
Yes.
Okay. So one, of course, is the fact that I wanted to say something about the trauma center at St. John's. Some years ago, I was on the St. John's board, and the St. John's board, contrary to some folks might think that St. John's just let it happen, but St. John's board of directors and management really tried to get the hospital named as a trauma center. It had to go before the board of supervisors, and the only one who supported St. John's becoming the trauma center was Supervisor Zaragoza, keeping the residents of Oxnard in mind. I wanted to say the cost of the services are determined by the insurance of the patient, assuming that the patient has insurance, correct?
It goes a little bit deeper than that. So the cost of the services for the ambulance transport, that's actually set by the county and the county board of supervisors. And so then it becomes a matter of what the reimbursements are based on the breakdown of the patient population. So Medicare, Medi-Cal offer a lower reimbursement than say a fully funded person who has insurance. And then there's people that actually just will pay cash, and then there's some people that just can't afford to pay. So it varies based on the patient population.
But if a person has no insurance and they're not able to pay, they're still providing ambulance services? The number of people who don't have insurance of any kind.
Yeah, they're still providing ambulance services, absolutely. And so there is, and some of that is that uncompensated care that I talked about was, that's where, so the ambulance company can bill, I believe right now for a transport, it's $1,700. Is that correct? Yeah, $1,700 for an ambulance transport. And so anything below that amount, that the ambulance does not receive, they count that as uncompensated care.
And again, that is covered by county?
No. Do you, go ahead. Yeah, I'll have EMS coordinator Via come up. He has a very deep understanding of this material.
Good afternoon. So the easiest way for me to explain it is that they do, essentially the county doesn't pay for it. The county ultimately has the responsibility to account for any kind of indigent care. So that is a statute, that's a mandate. What happens with the private ambulance provider is that there's a set rate from the county. They set the ambulance rate, and that's to account for both those who are going to pay from the private insurance side, plus the governmental insurances, and those who simply cannot pay. So that figure that the county board of supervisors sets takes into account the loss that they anticipate that a ambulance provider is going to incur over the course of their contract period. When a ambulance provider gives a free transport for somebody, and they say it's free, but when they do that, what they do is they consider that uncompensated care. They reflect that against their profit and loss margins, and then that's how they come to their overall reporting when it comes to how much money they are stating that they make. The problem with the ambulance providers right now is that they use that profit loss margin, and then they try to represent that as an operational cost. So even though they may, and let's just say in theory, they may make $6 million, they will report anywhere from $4 to $5 million in uncompensated care, which is just essentially what they couldn't collect. And then they will try to reduce their operating costs by that, and then try to represent that as how much money they're making to the public face. So as long as they stay above 10% within that operational cost, that's how they'll tend to represent it to the general public, if that makes sense.
Yes, now just from the chief's presentation, it did seem that there was less of an incentive to serve people in say South Oxnard because because they were deploying ambulances to Camarillo and Ventura instead of Oxnard. Did I get that right?
Yeah, they did, but it's not so much, in that instance, it's not so much about, Oxnard is actually a relatively profitable city in terms of ambulance transport. The issue that the ambulance companies have and why they were moving ambulances into Ventura and Camarillo is driven by profit in the sense that they needed units. It's easier to cover that 90% compliance in Oxnard just because we're such a densely populated city relative to some of these other areas. And so their desire to move ambulances out was not so much driven by reimbursements and receipts from transport, as much it was driven by ensuring they're hitting their compliance numbers in those other jurisdictions as well.
Okay, thank you very much. Appreciate that.
Member Lopez, any comments or questions?
Yes, thank you. I really, really appreciate this presentation, and definitely shines the light on the greater issues that we have. I just want to get a better understanding of what the city, not just the city of Oxnard, but other cities, what their role has been in these contract negotiations or the renewal of these contracts, and if there's any issues that we would have going through this. I mean, I think this is really good for us to move forward with, but just wanted to get a better sense of what this has looked like. And sorry, and the second question before I forget is at what point and how was it decided to reduce the number of units in the city, and why that wasn't raised as an issue, whether it was at the county level or by the city?
So to answer the first question, there was a lot of interest early in this consultant report that came out. It seemed like other jurisdictions were looking into the potential of doing something other than falling in line with the recommendations that were contained in that report. However, really since the pandemic has started, we haven't heard anything from those other agencies, and we were planning to come back to you hopefully soon with the results of this feasibility study, some options, and then some avenues of how we could potentially implement some of our consultants' recommendations. And then the second part of the question was, that's right. Thank you. In terms of how they move ambulances around, again, that is all governed by their contracts. Remember, these are contracts that have just been grandfathered every 10 years for the last 50 years. And so they actually get exemptions on some of these time delays and these different things. And so every new exemption they get, the ambulance company has some very smart people figuring out how they can make more money out of those exemptions. So they get exemptions for heavy traffic. They get exemptions for a high call volume. They get all kinds of exemptions. And so they will use that to move ambulances out. And essentially there's no ability within the contract to be able to hold the ambulance company's feet to the fire. One of the things that early on, and when we were starting to look at service delivery for our residents, we were looking at, well, why aren't they forced to add another ambulance to help cover our city? And ultimately, once again, it comes down to dollars and cents. And so last year, the ambulance company here in Oxnard was fined $40,000 for being late to calls and being out of compliance. And it costs about $800,000 to staff a 24-hour ambulance for a year. And so therein lies the issue, is that their contract is built for profit, not for patient outcomes.
Thank you. Appreciate the information in the presentation.
You're welcome. Chair McDonald, I don't believe your mic is on.
Okay. You can see my lips moving, but I'm not saying anything. How about now?
Yeah, we can hear you well now. Thank you.
Okay, sorry about that. A couple follow-up questions, and then just some general comments. It seems in reading this report, and I can't find it now where I read it, but that there's an oversight body that advises on this issue, and that, if I read it correctly, Oxnard, although we are the largest city and have 1/4 of the county's population, we do not have a seat or a voice in that oversight board. Is that correct?
Correct.
Jeez.
Okay. And I've periodically I'll get on my little soapbox and make comments about EMS and trauma centers and all that stuff. And they say you really shouldn't jostle a hornet's nest, but I think at this point I'm probably just going to punt it down the street and see what happens here. Oxnard should have been a trauma center, and I know St. John's worked very, very diligently to try and become a trauma center, and they were not selected. And just some anecdotal information, and I used the DMV address down in South Oxnard as a point of origin. From DMV to St. John's is 4.9 miles. From DMV to VCMC is 11 miles. St. John's is just about a mile off the freeway. VCMC is about 1 miles off the freeway. And I bring this in or up because as a person is injured, and there's five categories of trauma needs, that when they're designated as a trauma necessary patient, they have to go to VCMC. They are not allowed to go to St. John's. And I think St. John's would be quite capable of treating them if they had the ability to become a trauma center. St. John's has been expanding. They've been doing a lot of improvements. I think there's some real opportunity there. So that would be my first comment. The second one is that my understanding is that if fire is dealing with a person that's in full cardiac arrest, and it appears that the journey to the trauma center is going to take 20 minutes or longer, that patient is, what the term they use is called, which means that they stop all life-saving support, that all work ends because of the inability to get that patient to the trauma center. So that could very easily be someone in South Oxnard. And I think it's unconscionable that, I'm using one of the mayor's terms, but unconscionable that we would tell someone, we're going to stop trying to save your life because it's more than 20 minutes to a VCMC or to the trauma center. So, terribly sorry, but that's the way it is. That's what they tell us to do. I don't like that concept, and I don't know if it's true or not. I'm hearing that it's correct. I tried to find it online. I think this study should address something like that about basic life-saving efforts. I don't think we should be stopping to work until we have an opportunity to get a person to a medical facility and get them treated. That's just me. I'm also told that approximately 70% of the monthly trauma cases seen by VCMC are coming out of the city of Oxnard. So once again, if we're responsible for that many trauma cases, then why don't we have a trauma center here in Oxnard? Again, I don't like that. I think my community is being treated as the stepchild of the family. And although we're the largest entity in the county, we have the most population, we're being treated like we're not even part of the family. We're just being ignored as far as I'm concerned. So I fully support this. I think we need to go an extra step and make sure that we include St. John's in these discussions. I'd like to get some answers to questions of, how many trauma patients are coming from the city of Oxnard? And I think it will show there probably is a true need for my community to have a trauma center here in the city of Oxnard. And I think we need to have the ability to oversee the ambulance services here in this community, which currently we don't have. The county oversees that. And I don't like that at all. So I will fully support this. And I think this needs to move forward, move to the police department. And so I'll just stop there at this point. I've probably already irritated some folks, and we'll see what happens. We'll go from there. But Mr. City Manager, did you want to add anything to this discussion?
Yes, thank you. I just want to make something clear for our community who may be watching or tuning in later. We only have one goal here, which is to improve and increase the level of service in Oxnard. So when we're comparing to how the service is spread across the county, I don't want anyone to think that we want to have our service increased by reducing the service in other communities. It's not that at all. We just need the level of service in Oxnard to increase. So that is our only goal here. So as we go through this process, wherever the chips may fall, I just want to be clear, that is our only goal, to increase the level of service in Oxnard. And we'll figure out the best way to get there. Thank you.
Thank you, Mr. City Manager. And I wholeheartedly agree with that goal. It is about service to my community and getting the best service possible to my community, not at the detriment to anyone else. But I think we've been neglected, and I think it's time to change that image. So what's the pleasure of the committee?
I'll move the recommended action, and I'll totally endorse your comments, Chair McDonald, and the comments of our city manager.
I'll second.
Madam Clerk, we have a first by Mayor Pro Tem and a second by Member Lopez. Roll call, please.
Member Lopez,
Yes.
Member Ramirez,
Yes.
Chair McDonald.
Yes.
The motion to approve carries 3-0.
Thank you very much. Thank you, Chief, and thank you to all the staff that participated in this. We now move to item D2, High-Tech Task Force Agreement.
Alex. Something's happening and we don't get to see what the fun is about.
The commander is sanitizing the podium. And we just recommended she did it twice.
Good thing.
Good afternoon. It's Commander Sharon Giles. I am the commander over the Investigations Bureau. Good afternoon, Chair McDonald and Public Safety Committee members. I'm here today to talk to you about the High-Tech Task Force Agreement. This agreement's been in effect every year. We've done it since 2001, which was the year that the task force was actually created. After my presentation today, I asked that the Public Safety Committee recommend that the City Council approve and authorize the purchasing manager to execute a 2-year agreement with the Ventura County Sheriff's Office for high-tech task force services in the amount not to exceed $100,000 a year. In the past, from the police department standpoint, we've always done this annually, a contract, and I've decided actually last time and this time that we would actually do it for 2 years as opposed to doing it for just 1 year. It's just a necessary evil in our job that we have to have such groups to be able to do forensic examinations and various kinds of technology that we don't have at our disposal at the police department. So a little bit about the High Tech Task Force. Again, like I said, it was created in 2001. It provides law enforcement, educational, investigative, and forensic cyber support. They consist of about 13 employees. I think they have 12 right now. They're actually hiring to bring up to 13 employees. And they vary from the district attorney's office, investigator's office, and then also the Ventura County Sheriff's Office. Oops, I'm sorry. I forgot I had this. I cleaned it and there we go. Sorry about that.
Welcome to technology.
I know. Talk about technology. So all law enforcement agencies in Ventura County actually subscribe or signed an MOU with High Tech Task Force for services to be able to do their investigations. And then also they handle some of the apprehension of suspects who do technology type crimes. They assist us with those apprehensions. Again, like I said earlier, is that most of the members of the Ventura County Sheriff's Office are actually civilian employees that work there, and the sworn people are from the District Attorney's Office, Investigator's Office. Some of the services that they actually provide us, cell phone forensics, computer forensics, vehicle forensics, drone, malware, and then also they assist us with internet-based crimes. We have a couple of detectives that actually conduct internet-based sex crimes. And we are part of an organization out of the Los Angeles Police Department and with the FBI on the Internet Crimes Against Children Task Force. And so they assist us with that. They're also members of that. They help us with what we call Undercover Chats. So pretty much speaks for itself. You know, we pretend that we are a 12-year-old and we go out on the internet and we fish and see what we can find in reference to finding someone that is either sharing pornography, engages the 12-year-old in taking pictures and uploading that on the internet for the suspect. They help us with those kind of investigations. Even though we have, like I said, we have one detective that actually does that, but they have a whole group of people at the High Tech Task Force that are very good in these areas. They help us with human trafficking cases. Like I said, a lot of times these cases are, a lot of the documentation for their crimes are actually embedded in these computers or their cell phones, and they can retrieve that evidence for us. Just to give you some idea on how often we actually use them, in 2019, they helped us with 79 cases. So that means there was some type of computer, cell phone, something of that nature that we brought out to the task force, and they retrieved the evidence and then provided that to the district attorney or to the police department if there was an arrest on the case. And a lot of these cases, just so you understand from the community, for the community to be able to understand really, is that a lot of these crimes, if we make an arrest, then we have to have a lot of the evidence to the district attorney's office as fast as we can so they can actually go forward because of the time restraints in reference to court proceedings. In 2020, year to date, as of a couple of weeks ago, they had actually taken on 31 of our cases and investigated them. And I will tell you that that has just decreased slightly from the previous year, just because through ICAC, through the task force out of LA, they were nice enough to give us what's called a gray key device. And that helps us get into cell phones. And we have one detective that actually has training in that area where he can actually go in and retrieve data from cell phones and then analyze all that for us. So that's been a big help, but technology today, every crime has some kind of a technology component to it. I said this earlier that all law enforcement agencies in the county pay for services of the high-tech task force, and every agency it's paid on a percentage of the county population. Oxnard obviously is the biggest city in the county, and our portion is 24.48%. It's usually under $100,000 a year, and that's why I wrote it, because I know based on the population that I've seen since I've been doing the contract for this is my 4th year, that I'm like, in the next 2 years, it's not going to go over $100,000. So it's easier for us to be able to write it not to go over $100,000 annually, instead of doing it every year and being in front of you guys every year. Because like I said, we've been doing this since 2001. And OPD pays for a percentage of the office system coordinators, 3s. Those are basically your forensic computer examiners. And that's pretty much it. I'll just give you another little bit of information, is that, for instance, some of the technology or the software and the hardware that the task force actually has, the reason why it was created years ago is because a lot of the agencies could not keep up with technology and the cost of doing business, and actually having forensic examinations and having the software to be able to do those. One of the devices that they actually have at the high-tech task force, they just recently obtained this, and it's called the Cellbrite Premium, and it's basically it's a software package that can actually, when a phone's locked and they won't give us information as to how to get into the phone, the suspect won't, then they can actually get into this device, and that subscription to that a year is $150,000. So that just gives you an example of the kind of expenses that are associated with conducting these kind of investigations. So that's why the county pretty much went to the task force. Any questions?
Committee members, do you have any questions?
I do, as usual.
Sure.
Thank you. Thank you, Commander. Your sheet there said 79 cases last year of, it was cases, but are they actually arrests and convictions, can you say?
Out of the 79 cases, no, I wouldn't be able to tell you out of that. I would have to look into it a little bit further, but those are, so they don't do our case for us. So again, we would make the arrest on the case, or we may not be able to make the arrest on the case, and we would actually submit whatever evidence we have or device that we have to be able to build a case against somebody. So some of those cases, even though there were 79 submitted, I could not tell you the number, but I can guarantee you there's probably some cases that are still lingering because we probably don't even have all the evidence back. Sometimes on computers, people think just based on TV shows that we can probably get something within 24 hours or within hours. And some things we can, cell phone extractions, we can actually get those pretty fast. Thanks now because we have Gray Key. And we've been very successful in those, especially in our homicide cases. GPS is amazing. GPS in cars, your GPS on your phone. Those are the things now that we actually have a detective in the police department. We created this position a couple of years ago where we have a detective that does nothing but that. He's assigned into the investigations bureau. He helps the gang unit, the family protection unit, and then also the homicide unit, and gets us as much information as fast as he can to help us with our case and get an arrest in a timely manner.
So let me see if I understand. The cases you're talking about are just typical, they're all kinds of internet-based crimes. They're not just the ones trying to seduce young children, correct?
Correct. So we have a detective that does specifically that. He does use a task force quite a bit. Let's say he writes a search warrant and he looks at who's downloading child pornography. Anything to do sexually related, we have a detective that specifically does those kind of cases, but they do use the assistance of the task force itself when they go out to do a search warrant, download the computers, because they can bring out a whole forensic team and they can go in and look at all the computers right then and there. Back in the day, what we used to do, and Chair McDonald will remember this, is that we used to go out with the high-tech task force, and we would take, if there was 11 computers in the house and they were named on the search warrant, we would take those 11 computers, and it would take us forever to be able to go through those. Today, thanks to technology and the wonderful service at the high-tech task force, we take that team out with us. They scan those computers. They can see from the equipment they're using whether or not there's child pornography or anything that we're looking at specifically that's outlined in that search warrant. And then we don't have to take 11 computers and then bog the system down by tagging them into evidence and then having to go through them. They know right then and there, like, hey, there's something on there, and we can take only what we need.
Hey, that's it. Thank you very much. Great
Member
work.
Lopez, any comments?
Yeah, it's similar following to Member Ramirez's comments in terms of if there's a certain type of crime that is more common or you're seeing more of, and what the difference is between the use of technology to facilitate a crime versus the crime happening over technology, or like scams and that sort of thing, or if there's a difference in that.
So I'll answer the last part of your question. So scams, we have a fraud detective, and that's exactly what she does, is those, and she's actually a forensic examiner. So she has her licensing through the FBI to be able to go through computers herself. So she can do that stuff on her own. And then our detective that does the internet crimes against children, he will, like I said, he will ask for assistance with the task force. And then other crimes could be, let's say there's a gang crime, and that person had sent information to somebody else, either via computer or through a cell phone. Then we can also locate people by their GPS coordinates. And again, those are things that we can actually do, and a task force can actually help us do that if need be. But if there's an internet, like say a sex crime, a molestation case, a detective from the sexual assault unit takes a computer. They can actually take it if they were using pornography or whatnot, let's say, they can actually take it to the task force. Their forensic examiner can look at it, and then they will give a report, and that report goes to the district attorney's office. Did I answer your question?
Yes, yeah, just looking at the different types, like the crime happening, over like the internet versus, someone's phone having information that could be used. So I definitely see that this is a very challenging, job on everyone's hands, especially as technology just develops even further.
Oh, yes.
Yeah.
It's definitely changed over the years. I think it's one of the fastest growing crimes in the country, is technology-based crimes.
All right, thank you.
Thank you. Thank you, Commander. I know from what I've been told that the first lunar landing on the moon, obviously, that the computer ability in that spaceship and in NASA was less than what's in the average smartphone that we all carry around in our pocket or on our belt. And for any of you that carry around a smartphone, just rest assured that Big Brother knows where you are at every second of the day. And they're probably listening to you too, but that's okay. I don't have an interesting life, so they can listen all they want. But, and Commander, I'm just really saddened to hear that you don't want to appear in front of us on a yearly basis, but that's okay. I can live with rejection. So
I just think it's easier for everyone involved.
I agree with you. So the high-tech task force is just phenomenal. And, my wife has a group of friends, and when she talks to them, she's here, one's in England and others in New Zealand. And I think there's some in either Sweden or Finland. I just got corrected. Anyway, they all talk in real time on the computer over the internet. And it's just like they're sitting in the same room chatting. And so It's just that the technology is phenomenal. And you read now that looks like the biggest trend now is ransomware, where people find a weakness in systems, find a way to get in through what they call a back door, and then encrypt the files and say, hey, if you don't pay us in Bitcoins, which is terribly expensive, you'll never see your data again. And so having people that understand these systems and are able to effectively deal with them is just phenomenal. So I think this is a great investment, well worth the money, and I fully support this. So what's the pleasure of the committee?
I'll move the recommended action.
I was deferring to you, Councilwoman Lopez. I'll second that.
Okay, Madam Clerk, we have a motion and a second. Roll call, please.
Member Lopez,
Yes.
Member Ramirez,
Yes.
Chair McDonald.
Yes,
The motion to approve carries 3-0.
Thank you.
thank you very much. That takes us to item number 3, which is future agenda items requests. And
Thank you,
I
Mr.
think we may
Chair.
have the shortest list of all the committees.
Well, so far today, we are going through this exercise at every committee today. So you have your list in front of you, and we're going to get it on the screen. Once again, they're numbered just to help us communicate with each other today. They're not in an order of priority. However, we are asking you to review these. And then I have the police chief who's here, who's going to help us walk through some of these, because I believe some of them may have been completed or underway, or so he's going to help the committee go through this list of the 6 items for the committee. Thank you.
Thanks, City Manager, Chair Magnum, I'm sorry, McDonald and committee members.
I know where you live, Chief.
Item number 1 is actually a fire item. I know item number 2, we gave a presentation to the committee on February 2nd that was titled City Sponsored Youth Intervention and Prevention Programs. Item number 3 and 6 are related. On March 10th, we gave a presentation to this committee on pedestrian and bicycle safety that was related to a grant that we were receiving. And then it was on the agenda for council on April 7th. Item number 4, it's probably been about, my guess would be about 5 or 6 years since that came to council. The county had initiated a spay neuter program for the unincorporated areas of the county. They encouraged the cities to also have a mandatory spay and neuter. To my knowledge, none of the cities actually have that, or none of the big cities. I could be wrong. I just saw this today, so I didn't check every city, but we actually brought that to a council meeting here back then, about 5 or 6 years ago, and there was a lot of pushback from the community, and there wasn't. There was no appetite, at least then, to pursue this any further. Item number 5, we talked about this. It was 2 years ago, November of 18, when that business tried to go in the gun store on West Woolley Road. We talked about that. Talked about all the California and federal laws regarding that, and the fact that cities, you can't overstep those laws. But we did change our city code to change in a sense, the zoning for those businesses. But we have not done a presentation on specifically on gun violence restraining orders. So that's my update.
Okay, Mr. Nguyen, did you want to go by a committee member, or how would you like to do this?
Yes. Let's do that.
Okay. Well, I will start out and say that the lifeguarding programs, as much as I'm interested in them, I think we need to find out the financial status of our community before we can really go aggressively on that. So I would say I'm still interested, but defer that for a while till we see what the election brings us. In terms of gun control efforts, gun violence restraining orders, I don't know about the other committee members, but it seems like on almost a daily basis, I'm reading either in the briefings or on the paper or hearing in the media about convicted felons being arrested with firearms or restricted persons possessing firearms. And I can't help but wonder that where is our system failing in that these laws are on the books, the police department or whatever agency is making arrests, and yet they continue to happen. And I can't explain why they continue to happen, and it's frustrating. I think there's a lot going on. There's a lot of things happening, especially in regards to gun violence. And I'm not advocating taking away everybody's firearms or doing anything like that, but we need to have a system that appropriately deals with these types of violations, because it just doesn't seem like it's a functional system now. So I'd like to see that. In terms of mandatory spay and neuter, I know the city has a policy regarding higher licensing fees if your animal is not spayed or neutered. All of my animals, save for one, have been rescue animals. The first thing we did with each of them is took them to the clinic and had them altered. So I think when you see the amount of unwanted pets in the shelters, that there is a real need to look at this. Whether I want to go to the full step of making it mandatory, I'm not quite convinced yet, but I think we need to look at it. And youth intervention is always important to me, be it through recreation, boys and girls clubs, or whatever else. We need to have a holistic approach to dealing with our youth to make sure that they don't make poor choices and end up having to be subjected to the criminal justice system. If that's at all possible, then that's what we should be doing. So those are my comments on what would be my priorities. Mayor Pro Tem?
Thank you. I really do wish we had the resources to create a lifeguard program. We have the most wonderful beaches, and they're getting better all the time with the council's efforts to reduce industrialization of our coast. But this is a reason why I really hope that Oxnard residents support Measure E. So we'll have more resource, and we're really strapped right now for this and a lot of other things. Youth intervention, you know, I look at the daily media reports, and I know that it seems like so many young people go off the rails. And, you know, there's been a lot of talk about how we spend our public safety dollars. And I know that we are very strapped in that regard. And I don't know what we could do without money, but with other agencies working on those issues. I do think that youth violence in particular has a lot of its origins in unhealthy family situations, unhealthy housing and health, and a lack of mental health. But maybe that's a little bit beyond our reach right now. But we should continue looking at those other agencies that are working on such things with our youth, and try to have good relationship and, you know, help each other. Pedestrian and bicycle deaths just continue. That's the same as item 6, and it's a problem all over our region, and certainly in Oxnard, Port Hueneme, we know several people have died recently from these encounters, people getting hit. And it's not always the driver's fault. It's sometimes the pedestrian or the bicyclist not understanding what the rules are, not acting responsibly. So it's very sad, though. I'm the chair this year of the Ventura County Animal Services Commission, and we all know that it's a huge budget hit what our city has to pay for animal services, and we've turned over the licensing, which I think is great, to the county, and they have a good way of doing it, and maybe takes the burden off us, but we still have to pay a lot. And so when in our meetings, it's always a concern, when is Oxnard and when are the other cities going to really do something about people not fixing their animals, so that we don't have these sad situations of stray animals and animals that that can't find a home. So I'd like us to take another look at that when we have the resources to do that, and keep up the public education about that. And I know that some people just don't. I think the reason that we didn't go forward with it last time, the pushback, as the chief mentioned, was perhaps a feeling that people would start not licensing their pets because they don't want to be forced to actually pay for the operation, or they wanted to breed their animal. So I think we need to keep looking at that, because there might be a cost benefit to the city. So gun control efforts. Today we had an incident. I don't know the details, but we got the word that someone had threatened his family. Maybe there was a shooting, and then he went on this chase all over the area, and finally did get taken down safely by the sheriffs. But what was that about? Continuing emphasis on domestic violence, and that's a public education campaign. It's a complex problem, but I'm really glad to see that our police agency did a presentation at the last council meeting about it. I passed by the police station. I see the signs are up. Let's keep the awareness up. So I like these ideas, and of course we have to find the resources to do that and the time. So I'll leave it there. Thank you.
Thank you, Member Lopez, your input.
Thank you. Yeah, I mean, definitely all very important topics. And I think just a matter of identifying which ones are, within closer reach for us to consider and act on. I think youth intervention, there's always, we're always going to be looking at that. Very important as an ongoing area to look at, as well as the pedestrian and bicycle deaths. I think, road conditions, we're seeing a lot of improvements in the city, and, hopefully that's, one factor that will help in how we make our roads bicycle and pedestrian friendly. In terms of the gun control efforts, and more specifically, I think when I brought this up, it was more as an effort to educate the public on the process with restraining orders, and having our community informed of what that looks like, and how that could be an effective tool, for some individuals, some families. So I think that is definitely one that I would like to see as the opportunity and time is available. So that's it. Thank you.
Thank you, Mr. Nguyen. Did we give you clear enough direction or advice or whatever you're looking for?
Yes, and the chief is going to make some comments as well.
Yes, thank you, Chair. Just a couple comments from things that you guys had said. In regards to the pedestrian and vehicle injuries, as you guys were talking, I thought of our current situation with COVID, and our traffic enforcement has gone way down, but the number of collisions and injury collisions has also gone way down. And the reason for that is just there's less cars on the road, and it shows what happens when you have whatever the number is, 20, 30, 40% reduction just in the cars on the road, how much safer it is, because our roads are not built for this many people. And so if it shows that the answer isn't always enforcement, but engineering. And we know engineering takes money. And so as a future goal, as the chief, I would say, let's try to do the best we can to improve the engineering of our department, so we're in a better position in regards to that. And then the comment, Mayor Pro Tem, you made about today's incident, we had actually taken guns from that person earlier in the year. I believe it was in July. I'm not sure because we came to this meeting here. I'm not sure if he actually again possessed a weapon, but he said that he did, and that kind of just goes to show how easy it is to access weapons. But we'll definitely come back with another information report on domestic violence restraining orders, gun violence restraining orders, 5150 holds that allow us to take guns, etc. Thank you.
Thank you.
And Chief, thank you for the comments. And I will just echo the comments of Mayor Pro Tem, and kudos to the police department and the allied agencies that assisted you with that call that originated in Oxnard, went to Westlake Village, and then came back to Camarillo, which was a very difficult situation. It could have been very different outcome, and it was peacefully resolved in the appropriate way. So kudos to all the agencies that were involved in that. And I know you as law enforcement agencies talk back and forth among each other all the time. So please extend my congratulations and thanks to all the other agencies that participated in that along with your agency.
I will. Thank you. And you guys have mentioned this also. Our officers probably 3, 4, 5 times a week make arrests where we recover guns from people that are unlawfully possessing them. So thank you.
Thank you, Chief. Okay, that takes us to the last part of our agenda, which is items for future agendas. Are there any suggestions for future agenda items?
Have enough on our plate right now. Thank you.
Thank you.
Thank
Member
you.
Lopez, anything?
Nope, we're good.
Okay, with that, we will stand adjourned. Thank you all and have a wonderful day and be safe.
Bye-bye.
Thank you.